Number 30 will tell us about angioplasty.
Angioplasty, a surgical procedure, may be also used to unblock the arteries that supply blood to the heart. During an angioplasty, a surgeon inserts a long, thin tube through the artery to reach the blockage. Then they inflate a small balloon attached to the catheter in order to reopen the artery, allowing the blood flow to resume.
Student Puchkova is invited to tell us about stents.
Stents are small, expandable tubes that treat narrowed arteries in your body. They can open narrowed arteries, reduce symptoms like chest pain, help to treat a heart attack. Usually made of metal mesh, they are put into arteries in a procedure called percutaneous coronary intervention, or angioplasty. They are used for people with diabetes who have a bigger chance of their arteries getting narrow again. In 2016, a new type of stent made of a special polymer that eventually dissolves into the body was introduced. This many new second and third generation stent designs are being developed. This stent is absorbed by the body and disappears after it has done its work.
This video will show you what actually a stent is. Valves. Heart valves are being replaced. Usually it's aortic valve or mitral valve. And a video about valve replacement is offered to you now.
If you are having an
medicine and surgery. The two main types of surgery to repair aortic aneurysms are open abdominal or open chest repair and endovascular repair.
We would like to show you some information about aneurysm removing, and you'll see a video about it.
Degenerative disease may cause the medial layer to break down, weakening the wall of your aorta. Blood pumping against the weakened area may cause it to bulge outward like a balloon. When this condition occurs in your chest, it is called a thoracic aortic aneurysm. These aneurysms may occur in one of several places, including the aortic root, the ascending aorta, or the descending aorta. Blood pumping against weakened aortic walls can lead to another life-threatening condition called aortic dissection, which may or may not occur within an aneurysm, form in the false channel.
Cured not only with such stenting or grafting, but with medicine too. Student Sechova is reporting about medicine used in heart disease.
A number of different medications can be used to treat heart diseases. Blood thinners such as aspirin. They are used to break up blood clots and improve blood flow through narrowed arteries. Thrombolytics are often used to dissolve clots. Antiplatelet drugs. They prevent new clots from forming and existing clots from growing. Nitroglycerin can be used to widen your blood vessels. ACE inhibitors can be used to decrease blood pressure. Beta blockers decrease your blood pressure and relax your heart muscle. Pain relievers may be used to reduce any discomfort in your heart. Digital drugs are digoxin. It is the most commonly used digital drug. Abicin, Gitelin, Digipuren, Cordigit, Lantozid. Beta blockers. They improve cardiac function, reduce the direct toxic effect of norepinephrine. Atenolol and Concor are beta blockers. Anticoagulants, they prevent thrombosis. Sodium heparin, warfarin, fluxum, phenylin, sincuma.
Nursing in cardiology is very important since a nurse is a chief assistant of a doctor. Student Klichkova will tell us about nursing in cardiology.
Cardiac nurses care for individuals with problems of the heart, blood vessels, and the circulatory system. You may work with infants with congenital heart disease, a middle-aged adult with a heart attack, or an elderly patient with congestive heart failure. You may also care for patients before or after a heart transplant. Cardiac nurses may work in a cardiac unit, a cardiac intensive care unit in a hospital, or a cardiology clinic. Experience is a definite advantage in cardiovascular nursing, as these nurses often care for patients facing life or death situations.
Nowadays, a wide range of the latest medical equipment have been designed. Please welcome Juliana, group number 30, that will tell us about more modern medical equipment.
Now, the doctors are changing from angiography, which has been a daily routine, to more complex setup, where cardiologists, echocardiographs, and radiologists work together. It requires close cooperation between these specialties.
We'd like to show you a video about Cleveland Cardiological Clinic in Cleveland, USA. It's one of the best clinics in USA, in the world. It was founded by 4 doctors, Kraft, Benz, Loaf, and Fisher. Surgeonists in cardiological clinic. Cardiological help in Odessa.
Oh, indeed. Haven't you heard about St. Catherine Clinic and Odessk's clinics?
Yeah, sure. Here you will get professional, good help if you have some cardiological problems. The presentation of Odessk's Cardiological Clinic is shown to you by Skipenko Lyubov.
Odessk's private medical clinic keeps a special place among diagnostic centers. CT coronary angiography is a procedure to diagnose the condition of the coronary vessels. Diagnosis and treatment. The most modern types of diagnostic studies of the body are presented in the medical diagnostic department. Today, Odessk's is a modern diagnostic center equipped with innovative equipment and using advanced technology in their work. Prevention and rehabilitation of various diseases can be diagnosed in the medical diagnostic department. The most modern types of diagnostic are presented in this department studies of the body. The surgical care of any complexity is operated in the high-tech patient unit performed by experienced professionals.
Thank you for that. And now we would like to show you another presentation of well-known Odessa St. Catherine Clinic. Clinic of St. Catherine is one of the private specialized clinics providing all the necessary consulting, diagnostic, and therapeutic care in the field of cardiology and cardiac surgery. This therapeutic and prophylactic institution is one of a new generation equipped with high-class facilities. High professional doctors follow the latest international standards and individual approach to each patient at the level of the best European clinic. Clinic for Vascular Surgery is the department of the Clinic of St. Catherine, has been treating a wide range of vascular diseases for many years. Our specialists successfully have been treating patients with cardiovascular diseases.
You know, smoking is very dangerous to your health, especially heart and lungs. So if you have such a bad habit, stop smoking as soon as possible. Here you will see a conversation about 2 students of our medical
Today,
school.
many people suffer from cardiovascular diseases. Sedentary lifestyle, lack of stress on the heart muscle, poor diet, and emotional overload result in an increase of adrenaline and blood pressure. You are in a risk group if you have diabetes, if you are overweight, and smoke regularly. Hey, why do you light a cigarette? It's the first time I see you smoking.
Well, I don't know. Just wanted to try. All of my friends smoke, so I thought to try.
You see, most of our friends used to smoke and it caused some serious health problems.
You must be kidding. What problems?
I'm absolutely serious. They have atherosclerosis, varicose veins, and so on. Others had even a heart attack.
Sounds bad, but one cigarette will do no harm, won't it?
In fact, even one cigarette has many chemicals which may cause cancer. So give up smoking and start taking care of your health.
Well, you may be right. Thanks for advice.